thank you so much for taking time to talk to me. My name is Nikki Zizaza with WJZ. So I just want to start with saying, so October is Breast Cancer Awareness Month, and joining us today is Dr. Sohar Bazyar.
That's right.
Okay, great. And you are a radiation oncologist with LifeBridge Health. And you're here to basically explain how radiation therapy works and at the same time the role it plays in treating breast cancer. So I understand that LifeBridge Health is kicking off their annual Mammothon, which is going to be October 21st through November 15th. And it's a personalized and convenient way just to pretty much prioritize your breast health. So I think a lot of people are wondering, what exactly does radiation therapy and as a radiation oncologist, what do you do? What exactly do you do, and how does radiation therapy treat breast cancer?
Great question. First, I think there aren't too many of us. There's only 5,000 of us across the US. That's fine if people are wondering what we are doing. But to briefly describe it, we are also cancer doctors, but each cancer doctor or each discipline has a different tools to fight the cancer. We usually use a high energy X-rays to fight the cancer cells. And as far as the breast cancer, the way that we do it is usually our patient comes to us after they had surgery for breast cancer. And we go with the radiation and target those areas that we are concerned to have any residual cancer. It could be surgical bed, it could be lymph nodes in the underarm area or in the neck. There are cases of the cancer or breast cancer that they are unresectable for whatever reason. If the patient is medically not fit or if the tumor is too big, so we go before the surgeon and we try to shrink the tumor. And there are also cases of breast cancers that are outside of the breast. They are sometimes in the bones, and we go with the radiation, really precise technique, target those and zap those areas too.
And how do you know, as a radiation oncologist, which treatment to go about? Like, is it obvious when radiation therapy is what is appropriate in terms of the treatment plan you have for someone dealing with breast cancer?
So it is not. And let's say it depends on lots and lots of factors. And there are, of course, disease factors like what kind of breast cancer they have, where the breast cancer is in the breast, or which side of breast actually harbors cancer. Is it one side, two sides, both sides? And then also there are patient factors. How old is my patient? How is she doing? Is there any other disease? Are they doing fine? Is she premenopausal? Is she postmenopausal? And finally, also, there are some new ways for us or new techniques and risk stratifying ways that called oncotype or decision RT. Those are also new things that tells us how aggressive the tumor is, and then also we need to give them the radiation. One additional factor is that what is the other oncologist or medical or oncology disciplines going to do for our patients? If my patient getting the lumpectomy or part of the breast is removed, it's really different compared to the patient that had a mastectomy where they removed the whole breast. Also, if the patient had chemotherapy before surgery or there's a plan for chemotherapy after that, it's going to affect how I'm going to treat them too. And all these decisions are not made in solitude. I need to sit my team, which includes a radiologist, us as a radiation oncologist, surgical oncologist or breast surgeon, and medical oncologist or chemo doctors. We need to sit together. We need to go through each cases and make our recommendation based on the data that we have. Then we sit with our patient and tell them these are the recommendations, these are the alternative ways, and they need to find out what benefits best in their life and what is the treatment that they can go through that. And those are the people that are making the final decision.
Absolutely. And so, in terms of early detection, how important is early detection in making radiation therapy more effective?
Great question again. So I think it's really important. The way I try to describe it for my patient is that I just tell them, hey, sorry for the background. This is a hospital.
It's okay. It's okay.
So this is just to simplify it again. I just tell my patients that just compare it with a crack in the wall. If you have a small crack in the wall, maybe use one of your tools and patch it. This is when you have a big crack in the wall. You need to use multiple tools. You need sometimes tear the whole one, make the new one. So that's exactly the same concept. When I'm dealing with the early breast cancer, sometimes they don't even need radiation therapy and we can omit them. And even if they need radiation therapy, my field of radiation or how big my treatment field is going to be, the dose of radiation, how many times they need to come for the treatment is going to be really different versus the time that they actually have a more advanced breast cancer. And what does it mean for patient is less financial burden, also less effect on the quality of life.
Wow. So, what does a typical course of radiation therapy look like from start to finish?
First day that I see our patients is called the consultation visits. And that's when I sit down with my patients and their loved ones, and we go through all the information that I have. It includes the disease information, it includes the patient medical information and their living situation. And then based on that, I try to make a recommendation and alternative ways that we can treat their cancer. And if they decide to go with the radiation, the next visit's gonna be what's called the simulation CT scan. That's when they come back and I put them in a different position with their arms up and make a mold around their body. And all of these is to try to avoid the area that will get the radiation therapy that is not necessary. After CT scan, it takes me about a couple of weeks to have their treatment plan ready. Behind the scene, I'm gonna draw where the radiation needs to go and what is the normal or not involved tissue around the breast tumor are. It was for the breast cancer, the most important ones are lung and of course heart if it's the left-sided breast cancer. And when the treatment plan is finalized, they come to get their treatment. It's usually daily treatment, Monday through Friday. It's about half an hour per day, so it's not really bad. And it's usually pretty manageable, even for my patients that are working, they can fit it in their daily work life.
Wow. And my last question is really what are, if there are any, new advances in radiation therapy in terms of making treatments more precise or more effective? Are you familiar with any?
Yeah, so I actually have a background in engineering, and that the technical part of radiation oncology has always amazed me, and how much it will affect the patients. So we have came a long way from where we were just blindly radiate the breast and not looking at like where the heart is. But the new things that are happening, there are, I can say like at least three or four different things that is happening specifically for breast cancer. One is the way that we are trying to have the patient in different position or have them hold their breath, and we track actually their chest wall, actively making sure that they can hold their breath. You can imagine when you have a left side breast and I want to treat it, when you hold your breath, your chest wall is farther away from your heart. And
Yeah.
that space gives me enough distance to spur the heart. The other way is that we are doing a specific kind of CT scan called the 4D CT scan. I track their breathing if there are patients that they cannot hold their breath during the treatment. And then I treat them only in part of the cycles of breathing that they have the maximum distance from the heart. That's also going to spur the heart. Last thing that is new things are happening in the field of radiation therapy is called adaptive radiation therapy. What does that mean is that when the patient comes to me, they had surgery. So the breast is healing, the scar tissue is forming. Sometimes there is a fluid collection, sometimes there is a blood collection. So lots of things are happening and changing every day, and I'm adding the radiation on top of that. So we usually see a little bit of change in the breast contour day by day when you treat them. But with adaptive radiation therapy, I can adjust my radiation dose to really go to where it needs to go. And these even little changes can be monitored and managed. So it minimizes the dose that goes to the normal tissues and gonna spare them, and maximize the dose that's gonna go to where it's supposed to go.
Wow, this is also fascinating to so many people who just hear radiation therapy and they don't know much about it. Thank you so much for talking with me.